Alright, so since I'm working on a model today, I'm just going to be doing the seated position for the cardiovascular. So starting off, I would come into the room and I would wash my hands and put gloves on, greet the patient saying, "Hello, my name is Kenny Ordway. I am a first-year physician assistant student at Central Michigan University, and today I'm just going to be doing a cardiovascular exam on you. Is that all right?" After getting permission, I would go ahead and check the patient's blood pressure. Patient is usually seated for 5 minutes with feet flat on the ground, sitting up, and arm at shoulder height or at heart height. So I would just be grasping the arm right here and holding the shoulder and the hand in line together. After that, I would go ahead and check for the radial pulse and count for 30 to 60 seconds, depending on the rhythm and the rate. And then from there, I would go ahead and I would auscultate the carotid artery. So I'm auscultating first because if there is a bruit and I go ahead and palpate, I don't want to send anything to the head and cause any kind of damage or stroke. So going ahead, I'm going to listen to the bell first. Or actually, I'm going to listen with the diaphragm first for any noticeable bruits. And I'll check the other side to compare. And then from there, I switch over to the diaphragm and listen for any kind of subtle bruits. And I don't want to press too hard and cut the circulation off to the brain. Good. And now from there, after not detecting any kind of sounds of bruits or abnormalities, I will go ahead and palpate with the fingertips. And here I'm just feeling for any kind of bruits or thrills, and I'm not feeling any. So carotid artery is normal upon auscultation and palpation. From there, I'm going to go ahead and auscultate the heart locations, starting off with the aortic valve location, and I'm listening at the diaphragm first. So again, the aortic valve, and then moving over to the pulmonic, listening at the Erb's point, tricuspid, and then finishing it off with the mitral valve. Good. And then from there, I'm going to have the patient lean forward and exhale as I listen to the PMI. In this, I'm listening for any type of subtle murmurs or regurgitation, and I'm not hearing any. So again, I will do the same thing now with the bell and listening for any kind of subtle murmurs or heart sounds. So starting at the aortic valve, over to the pulmonic, to the Erb's point, the tricuspid, and then finishing with the mitral. And again, I'll have the patient lean forward and exhale. Good. So heart sounds are normal in all locations. No detections of murmurs or extra heart sounds. The rate and rhythm is normal. From there, I'm going to go ahead and palpate the same locations, and I'm going to do so with the fingertips first and then moving into the palm of my hand. So here, feeling for any kind of tenderness or any kind of heaves or thrills. Good. And then from there, I will check the sides as well. This is more so for the lungs, but just to make sure. And then from there, I will palpate the apex. And then moving over to find the PMI. And I will locate the PMI based on palpation. So the PMI is about 10 centimeters away from the sternum, which is normal. And then from there, do the same thing, but now palpating with the palm of my hand. So again, feeling any kind of heaves, thrills, or any kind of pain upon palpation. And again, feeling for the apex, and then finishing it off with the PMI. And that is the seated cardiovascular exam. Again, I would have the patient lie down where I would check the jugular pressure or the jugular pulse, and I would measure that with a ruler and a straight stick. And then from there, I would go ahead and auscultate and palpate in all those same directions, and then have the patient lie on their side, on their left side, and do a lateral decubitus palpation for that PMI as well. Thank you.